cases are surging with every passing day, and in a briefing today, the Health Ministry has said that Delhi is now among the top 10 worst affected districts. So in this episode of Government Matters, we'll try and understand why this fresh surge is happening, whether there's a reason that we can point to, and what the government is doing to tackle it. I'm afraid, and I apologize if we had a bit of a technical glitch earlier, so we have to restart this program. So thank you for being patient. I have with me today Avantika Ghosh, who, as you know, tracks health for ThePrint, leads our COVID coverage, and has written a wonderful book on the pandemic and India's handling of the pandemic. So Avantika, today the Health Ministry has, in its weekly briefing, given out some more information, including the fact that Delhi is now a cause of concern. Can you just run us by the important highlights of the briefing?
Right. So what they have said, this is a regular thing every week. For the last few weeks, the Government of India has been giving a list of the top 10 districts in terms of active cases. And Maharashtra has 8 of those districts have consistently been from Maharashtra, so that's not new anymore. But what is new this week is that Delhi has now landed at number 9, and the only other district outside of Maharashtra is Bengaluru Urban, Karnataka. Delhi has, in terms of active cases, it currently has 8,032 active cases. I'll just put that in perspective why Delhi is a cause for worry. Because numbers had really come down. On 10th February, the number of cases in Delhi, the number of daily cases was 132. Whereas on 24th March, it was 1535. This is the
new cases.
Right. Daily new cases. And these are the figures that the Government of India has given. And I was looking through the bulletin a little bit, and I found that on 29th March, the number went up to 1,902 fresh cases. And this when we were constantly doing 90,000, 1 lakh tests a day. And so also your test positivity rate which had gone down to 0.3%, it has been steadily rising. Yesterday there was a fall both in the number of cases and the number of tests done, probably because of Holi, Sunday, Holi, whatever. But actually the Holi dip, this would be the Holi dip, and also the Sunday dip together. So yesterday the numbers were 995 and the tests had come down to 60,000-70,000, but again the test positivity rate was 2.77%.
Right.
And our red flag for test positivity is 5%. So we are going very close to that, and we're going very fast. It's kind of, when you look through the bulletin, it's kind of unnerving how fast Delhi's test positivity is changing. And we cannot say that it's not testing enough, because we are testing quite a bit. So yeah, that's where we stand currently. Also, yesterday Holi, I don't know what happened in your areas, but where I stay, I heard a fair bit of noise, a fair bit of fun happening. And today at the press conference, when we were sitting there were quite a few people who had colors all over them, the remnants of playing Holi. And very interestingly, there at one point of time, and for a very long time we had all adhered to that, we would keep one row empty and one seat, we would occupy alternate seats, and every alternate row was empty. But today that was all gone. We were in a different hall, admittedly, but even then all of that strict discipline of all these months was suddenly gone. So it's clearly everywhere that people are letting go of COVID appropriate behavior. Somehow people are thinking that the vaccine is here.
Yeah, and that it's over,
It's over, or it's just like flu, people are not dying, whatever the reasons. That strict discipline of the last 1 year or so, I see that going down even around me, and I'm sure it's much worse. And talking about the country per se, there are 5 states going into elections, and I mean, you travel to Assam.
Right. I can tell you that in Assam, nobody is wearing masks. It's in big cities, it's an aberration, not a norm. And in the smaller towns, there is no concept of masks right now. So,
and from what I see of the West Bengal poll rallies, I mean, it's probably the violence and the vitriol that's keeping COVID away. Definitely not masks.
Right.
So, I mean, that's the way it is, and what the Government of India is telling the states. It's not rocket science. It's what they've been telling them for the last 1 year. It's the same, more of the same. But yeah,
people are not adhering to the COVID.
People are not adhering to.
appropriate
Maharashtra
protocol.
is already past its earlier peak. It has a new peak this time, and the speed at which we are increasing, so at our peak we had about 98,000 cases, and we are already at what, 59,000 cases.
Right.
So we're going there very fast.
Very fast.
And at this rate we will go past, I mean, even India will go past. Maharashtra has already gone past the first peak. Even India will go past the first peak.
So Avantika, that brings me to the next question. What is the reason for this fresh surge? Is it just that people are lowering their guards down, or is there, is the mutant strain a cause? Is there a cause that we know?
See, a lot of states open schools. It's been a year. I mean, life has to go on.
Right.
People are lowering their guards, certainly, but people are also returning, or at least trying to return to normal life. Delhi, for example, stopped weddings just, I think, Thursday or Friday notification came. So before that, weddings were happening. I know of several weddings which have turned super spreader events in Delhi. That has happened. Then festivals have happened. Plus, I think, so you asked about the mutant strains. The mutant strain numbers that we have here are actually still quite low. We have tested about 11,064, tested in the sense we have genome sequenced, of which 807 samples were found to have the UK variant, 47 had the South African variant, and 1 Brazilian variant.
Okay.
And the government's stand still is that the surge is not because of mutants, but having said that, states are facing a lot of difficulty in getting these genome sequencing results back. Punjab, for example, last week when they released that statement that they had sent 401 samples for sequencing and 81% had tested positive for the UK variant. When I spoke to the Punjab Principal Secretary Health, he told me that we had sent the samples to NIV Pune and to IGIB here in Delhi a long time back, and we were just waiting for the results to come.
Right.
Till the central team came, and the central team had the NCDC director, and Dr. Sujit Singh offered to run a batch of sequencing just for Punjab samples, and that's how we've got these results. So clearly our genome sequencing pace, like our vaccination pace, is not enough.
Right.
And talking about vaccinations, I am absolutely confident that one of the reasons why people are lowering their guard is because
they think there's a vaccine, right?
Yeah, but look at it this way. Today the figures that we were given, we started vaccinations on 16th of January, so it's been 2.5 months, and we have just done 90 lakh full vaccinations. That's very low.
Right.
Remember, our initial target of frontline workers, healthcare workers, people with comorbidities and elderly, that was 30 crore. Now when we open up above 45, the government of India still won't give us figures. Today when we asked that how many people are you hoping to cover in this phase, we were told numbers don't matter.
Right.
But numbers do matter, because if in 2.5 months you have covered 90 lakh of your target of 30 crore people, my maths is too bad. I'm sure, one of our viewers can do the calculation perhaps.
And right.
But my maths actually stops. All I can say is it'll take many, many months at this rate. That's not helping. Yeah, right. That's not helping anybody's cause. So people are saying, why can't I buy vaccines? Even before that, my question is, why can't states buy vaccines? States can strike their own deals with companies.
Right.
Why this tight control of, the center will give you vaccines and the center will give you this many vaccines in this much ratio, and you will have to do whatever you have to do with it. I'm not sure why this Inspector Raj.
Right. Well, I know, Avantika, you're in a bit of a hurry today, so I'll take 2 very quick audience questions, because a lot of them you've already answered. For instance, there was a question on the mutant virus. There was a question on pace of vaccination. So these are questions you've already taken. This is a question from Daksh about whether there will be another lockdown, and there's a related question from Rajesh about whether the initial lockdown was a waste. Does the current surge show that lockdown was perhaps a waste?
Depends on what you think the lockdown's target was. The government of India had said the lockdown is aiming to break the chain of transmission. If that is the target that you really believe in, then yes, lockdown was a waste, because all our highs happened post lockdown, right. Everything. However, from an epidemiological perspective, the purpose of a lockdown is not to break the chain of transmission. It's to give It's basically to stagger the numbers so that the government, by the time the surge happens, the government is better prepared in terms of ICUs, ventilators. And remember, the lockdown, I'm sure nobody foresaw that, but the lockdown bought us very valuable time in terms of understanding the disease, in terms of what works, what doesn't work. So remember, before the lockdown, we were not clamoring for ventilators. But by the time unlock happened,
we didn't even need the ventilators.
We didn't even need the ventilators. It was oxygen everywhere. It was steroids, which cost what, like, 10 rupees for 30 tablets or something like that. Steroids were the lifesavers. So that time the lockdown brought us to understand the disease better, to prepare for it better. But if you think the lockdown was supposed to bring down peaks, and remember, even before the lockdown, in February there was an ICMR paper that's still available online. You can go and check it. ICMR scientists had said that the size of the epidemic is going to be a constant. No matter what you do, the size of the epidemic, the number of cases, the number of people affected will not change. What you can change is the deaths, because you are better prepared. You can get people to the hospital early. You know how to treat the disease better. What you can change is that. But if you're looking at reducing the size of the epidemic, that's not going to happen.
Right. Well, Avantika, lucidly walking us through the current status of the pandemic in India and why it is a cause of concern, and really why people are lowering their guards down, which perhaps is leading to this fresh surge. So, as always, a constant refrain: please keep wearing your masks, do sanitize and wash your hands regularly, and maintain physical distancing. Well, thank you for watching Government Matters. I know we've taken a slight break of a week. I was traveling on an assignment on the field, which is why we couldn't do Government Matters, but I promise to be more regular now.